Hello everyone, I am Dr. D. Rahul. I am a consultant gastroenterologist and hepatologist working at Apollo Hospital, Secunderabad. Today we will be discussing a few points about gallbladder stones, also commonly called as gallstones. So gallstones is the presence of stones in the gallbladder. The most common type of stones are cholesterol gallstones. And what are the risk factors for gallstones? It is commonly seen in female patients who are above 40 years and who are overweight and who have also completed their family. Pregnancy is also an important risk factor wherein the gallbladder motility is decreased and there is a tendency to form small gallstones or gallbladder sludge. Apart from this, the other common causes of gallbladder stones are chronic use of an oral contraceptive pills or also some medications such as octreotide and also few antibiotics such as ceftriaxone. These are also known to cause gallbladder stones. Apart from this, there are various genetic factors which also predispose a patient for gallbladder stones. And also in a few conditions called sickle cell anemia, even in small children with sickle cell anemia or other blood dyscrasias, there is a tendency for gallbladder stones. So what are the symptoms of gallbladder stones? More than 80% of the patients are asymptomatic, and these patients are diagnosed on routine ultrasound screening for health checkups or ultrasound abdomen testing for any other causes of pain abdomen or something. So these are mostly asymptomatic stones, more than 80 to 85%, and only 10% patient present with right upper abdomen pain or sometimes mid abdomen pain. And sometimes if it is severe enough to cause cholecystitis, that is inflammation of the gallbladder, there may also be fever or severe continuous pain associated with vomitings. So an immediate ultrasound scan would detect the cause of the pain in those patients. So what are the investigations we do? So as already told, mostly it is found out in routine ultrasound screening tests, and once there is a gallbladder stone, if the patient is symptomatic, then if you do a few routine tests. How can we prevent gallbladder stones? Gallbladder stones can be preventing by following a few healthy lifestyle measures like maintaining a proper weight, regular exercises, and increased intake of fruit and green leafy vegetables. These are known to decrease the risk of gallbladder stones. There are also a few studies where show that coffee intake also reduces the risk of gallbladder, and unnecessary using of antibiotics and a few oral contraceptive drugs such as oral contraceptive pills also decrease the risk of gallbladder stones. So how do we treat gallbladder stones? Asymptomatic gallbladder stones are better left alone, but if the size of the gallbladder stone is more than 3 centimeters or there is a completely calcified gallbladder, or if the patient is also having serious comorbidities and is an elderly patient, then surgical removal of the gallbladder stones is the treatment of choice. In symptomatic gallbladder stones may cause acute cholecystitis. Laparoscopic cholecystectomy is the treatment of choice. But in few patients, if there is difficulty while performing a laparoscopic cholecystectomy, an open cholecystectomy can be performed and the complete gallbladder along with the gallstones can be removed.